Okay, the last static one that we're looking at then for a break is for quadriceps. So with quadriceps, just to give you an idea, and this can then be applied to hamstrings, it can be applied to lats and wherever else you want to put it, deltoids, arms, is that we're trying to visualize the anatomy as we do so. You don't have to be exactly in line with the muscle heads themselves, but I think that's a good way of targeting certain muscle groups and informing just where you're going to put the cups. Let's get some wax on there, and we are going to go down as low as tibialis anterior, because in this one, unlike many other forms of treatment, we're thinking about the anterior chain as a whole. And I'll explain that in a moment. So just be aware that anything ventral, anything protected in the fetal position is going to be more tender. So we'll probably draw the line of sartorius sort of along there. If we need to use that in place of VMO, then we can. If it gets too painful at any point, you let me know, okay? So we'll start off with the patella, with the quadricep tendon, just there. 2 pumps. And I may or may not go 2 pumps. You say, and if I need to just go down to 1. Good. And we're going to go up to rectus femoris first. Yeah?
Yeah.
As they go on,
That was a big difference, actually.
Let's see how this one is.
That was okay.
You can see I'm moving quite speedily because for the same reasons before, I don't want to leave this one on for minutes longer than I've left the last one. So we've got rectus femoris, also vastus intermedialis. And when you go either side, try and stagger it so that we're not right next to, because then we can get a bit closer in, being in a kind of triangle formation. So we're going to go another one there, and now we're getting into that lateral side. We know that the IT band can be a bit more tender. You doing okay?
Mm-hmm. Yeah, okay.
Good. And we can go all the way up with this one. Probably stop there, because we're going to run out of cups. And then VMO / sartorius, we're going to come around the inside. I'm not going to do so many because we go past VMO and we end up there into sartorius, into the adductors, which is not really pleasant. So looking a bit like pinhead there with all these cups. But you think about the connective tissue and the fascia, which is what we're trying to target, that is now being pulled out in a unique way. On some people, not so much with Andy, but you can see different lines between the cups. You can see the stretch in the skin, the stretch in the fascia. Some people more than others. There's one right there, actually. And they start to, you see that little line just there? Yeah.
That's got a bit more painful now. The pain's got worse now.
Really? Do you want me to reduce pressure?
Oh, yeah.
Yeah? Okay, just on these ones?
On the inside ones, yeah.
We'll just go for 1 pump. And don't hesitate to adjust, or don't feel like you did a bad job, because things can change as you go. So just 1 pump. Better?
Yeah, that's better.
Okay.
Yeah.
And we're going to go also down into tibialis anterior. See why? So for these, you might want to use the smaller cups. And as they start to pop off, then you can just go for a smaller cup. So make sure you find tibialis anterior between tibia and fibula. 1.5, just to keep it on there. We've got more pressure per pump with the smaller cups, but you go too few pumps, it's probably just going to fall off. Okay?
Yeah, that feels okay. Yeah.
Good. And now as a slight introduction to what we're going to do this afternoon, we can go a step further with what we're going to do here. I'm going to bring your leg off the side and slowly bend the knee. So what that's going to do, this has been there in position now for a few minutes. Hopefully it's acclimatized. It's my way of dressing up the fact it might be painful. If it is, just let me know, we bring the leg back up.
Yeah.
Okay, just try and relax for me. Leg off to the side and slowly bend your knee. Leg down to the couch. Just relax this leg down. Relax down. That's good. We're getting a stretch now through rectus femoris.
Oh, I can feel that.
And as we bend that knee,
Are they going to pop off?
you can imagine what's happening to these tissues.
Oh, I'm going to stop there, I think.
Yeah?
Yeah.
Where's that sore for you?
That's here, round here for me,
Okay.
and actually on my shin as well.
Right, because of the plantar flexion. If we then just keep the leg relaxed, the dorsiflex is probably not going to be quite so bad because we slacken those tissues, but into plantar flexion, it's going to cause a bit more, yeah. So would you like me to bring the leg back up?
Yes,
Yeah.
I'm ready to now.
Good. Okay.
Yeah.
As relaxed as you can. Some people will tolerate that much easier than others. You can see also in there, having a look at the markings, There's that red outline and that white sort of patch in the middle.
Oh, yeah.
Just another thing to observe at this point. I promise you, keep saying it, we'll cover that
Pinchier
later.
down on the outside actually now.
Yeah, that's
Yeah.
anything. I mean, ventral or medial, different terms, but similar in this case. Or lateral can be a bit more painful, especially to the ITB. So take these ones off.
Yes.
Get ready for the relief when you take them off. Like I said, it's always worth having them on first.
So what does the white line mean?
The white line, the bit in the middle.
Yeah,
It's difficult to say. I haven't got anything conclusive to say, but later on we're going to look at ideas as to what that can mean.
Oh, okay.
Usually it ties in with your objective assessment. So that's just going to be another angle for your objective assessment. You know, earlier on we saw it was a painful right shoulder, and there were slightly darker cut marks on the right side by the scapula. So what does that mean? It all depends on what we've seen on the objective. But just with the subjective, because we haven't assessed it, Randy said it hurts, it plays up. That's an interesting correlation that we can use. All right, this is the last one then before we move on to, in my opinion, the really interesting advanced stuff. I would like to give that a go, please. Try the passive knee flexion as well. Oh, that one's a little bit angry. The rest are looking okay. Does that one feel okay?
Yeah, it feels alright, yeah.
That's fine. It's not
Funny, isn't it?
it's not the worst you're going to see.
It looked like it got more angry when you did the when you flexed the knee. As well, when it was off the edge, and that's when it looked like it decided to get more angry.
And whether that's significant or not, like I said, all depends on the assessment. Did Andy come in with a quadriceps tendinopathy or some patella pain or anything like that? If not, it's probably just something, an interesting observation.
Yeah.
It's not really going to help the assessment.
That isn't it at that point, you know, I always complain about
Yeah.
that bit there when I run. That always hurts, I don't know why. Right on the point.
Okay, on the patella.
Very odd.
Yeah, it's not going to make or break any assessment entry with that, but it's an interesting, different perspective.